Bismillah ar-Rahman ar-Rahim. This is the third lecture of benign breast disease. The question now, what causes benign breast disease? Common causes of benign breast lumps or non-cancerous include changes in the breast tissue, for example, fibrocystic breast change, breast infection, for example, mastitis, scar tissue from a breast injury, we are seeing here in this slide fibrocystic breast disease, and we are seeing here in this slide the breast with fibrocystic changes. Hormone fluctuations, especially during menstruation, pregnancy, or menopause. Medication use such as hormonal contraceptive or birth control pills and hormone replacement therapy, caffeinated beverages, The question now, what are the symptoms of benign breast disease? You may notice breast changes or a lump while doing a breast self-exam, showering, or getting dressed. Sometimes a mammogram detects these changes. Besides a breast lump, other signs of benign breast disease include breast pain or myalgia, nipple discharge, change in breast size, shape, or contour, inverted crest or scaly nipple, dimpled, puckered or scaly breasts, The question now, how is benign breast disease diagnosis? If you feel a lump or notice breast changes, see your healthcare provider immediately. Sometimes a mammogram or breast ultrasound or your healthcare provider first detects a change. Your healthcare provider may order one or more of these tests. Imaging scans including mammogram, breast ultrasound, MRI scan for breast lesions. Lab tests of nipple discharge to check for cancer cells. Image-guided core needle breast biopsy, fine needle aspiration biopsy, or excisional biopsy to test cells for cancer. The question now, how is benign breast disease managed or treated? Most types of benign breast disease don't require treatment. Your healthcare provider may recommend treatment if you have atopical hyperplasia or a different kind of benign breast disease that increases your future risk of breast cancer. If you experience pain or discomfort or have an increased cancer risk, this treatment can help. Fine needle aspiration to drain fluid-filled cysts. Surgery to remove lumps or lumpectomy. Oral antibiotic for infections like mastitis or abscesses. Drainage for breast abscesses. The question now, can I get benign breast disease more than once? Benign breast lumps are fairly common and can occur many times throughout your life. Your breasts may feel lumpy or tender when hormone levels change due to menstruation or menopause. You should contact your healthcare provider anytime you feel a lump or notice a breast change. The question now, what are the complications of benign breast disease? Certain types of benign breast disease, such as atopical hyperplasia, make you more prone to breast cancer. Sometimes benign breast lumps hurt. Your healthcare provider may recommend surgery to remove painful lumps. For example, this is called lumpectomy. Unfortunately, some fibroadenoma lumps come back after surgery. The question now, how does pregnancy affect benign breast disease? Changes in hormone levels during pregnancy can cause breast lumps, tenderness, and nipple discharge. You are also more likely to experience benign breast changes or develop a breast infection called mastitis while breastfeeding. We are seeing here cases of breast lumps during pregnancy. Breast changes during pregnancy or breastfeeding are rarely cancerous. Still, you should reach out to your healthcare provider when you notice any breast change. The question now, how can I prevent benign breast disease? There isn't much you can do to lower your risk of benign breast disease. These actions may lower cancer risk and help detect disease early when it's most treatable. The first one, get regular mammogram screening. Perform self-exams to get familiar with how your breasts look and feel. Maintain a healthy weight. Exercises regularly. Drink alcohol in moderation or not at all. Quit smoking. Reconsider the use of hormone replacement therapy. Switch to a non-hormonal birth control option. The question now, what is the prognosis or outlook for people with benign breast disease? The majority of women with benign breast disease don't develop breast cancer. If you have a disease type that increases cancer risk, your healthcare provider may recommend more frequent cancer screening. Certain breast diseases can make you more prone to developing lumps. You should notify your healthcare provider anytime you notice changes in how your breasts look or feel. The question now, when should I call the doctor? You should call your healthcare provider if you experience a newly discovered lump, nipple discharge, changes in the way your breast skin looks or feels, inverted nipple, breast pain. The question now, what questions should I ask my doctor? If you have benign breast disease, you may want to ask your healthcare provider, what is the best treatment for me? Am I at risk for more breast lumps? How frequently should I get a mammogram or other cancer screening, for example, breast ultrasound or MRI scan? How can I lower my risk of breast cancer? Should I use a different birth control therapy? Can I use hormone replacement therapy? Should I look out for signs of complications? In the end of this lecture, thank you for all.